Thank you, everyone, and thank you to the PCFA for the opportunity to present this study, which is co-funded by the Prostate Cancer Foundation of Australia, and we also received funding from ARC Linkage Grant. And can I also acknowledge our international collaborator, Professor Kerry Cornea from the University of Alberta, Susan Broadbent from Victoria University, and our Deakin Uni collaborators, Joe Salmon, Melinda Craig, Cadron Gaskin, Mari Botti, Bridie Kent and Steve Fraser. And as you can see, our collaborators and partners are at the bottom of the screen. The Prostate Cancer Foundation, the North Eastern Metropolitan Integrated Cancer Service, Peter Mac, Eastern Health, the YMCA, Epworth Healthcare and Victoria University. So, it's well documented what the benefits of exercise among men with prostate cancer are, including the physical and psychological benefits from exercise. Now, these improved benefits include quality of life, improvements in quality of life, and general well-being, improvements in muscular fitness and capacity to undertake exercise, as well as physical functioning. The benefits of exercise for men with prostate cancer are particularly important for men on hormone therapy or on ADT because they are at high risk of osteoporosis. So exercise can be beneficial from strength training to maintain bone density and prevent bone loss. There are also therapeutic impacts which reduces the side effects of treatment such as fatigue. The Australian Exercise and Sports Science Association recommends that cancer survivors participate in low to moderate intensity exercise 3 to 5 times a week. It needs to be at least 20 minutes per session, and it needs to involve aerobic, resistance and mixed exercise. Now, despite this knowledge and these recommendations, this knowledge has not been translated into practice, and many men with prostate cancer do not engage in exercise. Now, for this study, we defined a prostate cancer survivor as a person as having completed active treatment 3 to 12 months post active treatment. So they would have completed their surgery or their radiotherapy within 3 to 12 months. We know from the literature that they are more likely to reduce their physical activity post-diagnosis, and some therapies do impact on the stamina and the ability to actually undertake exercise. And this has implications for the cardio and muscular systems. And we know that many survivors do lead a sedentary life. So our study aims to change this. So the ENGAGE study aims to, the first primary aim is to look at how effective a referral to a 12-week exercise program is compared to men with cancer who receive usual care. The secondary aim is to look at how effective the exercise program is in terms of their psychological well-being, so changes in depression or anxiety levels, their general well-being, their quality of life and their ability to increase their exercise and also their fitness levels over time. So this is a visual of the design. We randomised the clinician into either the intervention or the control arm. So survivors of prostate cancer who presented for a consultation at an outpatient's clinic, when they saw a clinician who had been randomised into the intervention arm, were assigned to the intervention group. And likewise, clinicians who were randomised into the control arm, for those patients who saw that particular clinician, they were assigned to the control group. At an outpatient's clinic, we introduced the project to eligible participants, and we gave them an information sheet, a consent form and a baseline questionnaire if they were interested in being involved in the study. And they took this information home so that they could consider being involved in the project, they could be well informed about the details of the project, and then 2 days later we call them back and we answer any questions that they may have and determine their involvement in the study. So if they agree to be involved, they complete the consent form and the baseline questionnaire, and they return it to us at Deakin University. Once we have received the consent form and baseline questionnaire, we organise the first fitness assessment, and that's for both groups. So the fitness assessment is conducted at Deakin University at the YMCA, and it involves strength, exercise capacity, aerobic testing, and functional assessments. Once they've completed the fitness assessment, for those participants in the intervention or the who undertake the gym program, they proceed through the 12-week program, which comprises 2 gym sessions and 1 home-based session, which is tailored to the individual. And this 12-week program is supervised by exercise physiologists from Deakin University. For those in the control condition, they receive information about exercise as part of their usual care, but they do not undergo any specific intervention such as the 12-week program. At the 12-week follow-up, they complete another fitness assessment, so it's the same assessments as at the first assessment. They complete the same questionnaires, and then at the 6-month and 12-month follow-up, we ask them to complete the same questionnaires, and so we're tracking them over time. So to be eligible to be involved in this study, it involves men who have completed active treatment for prostate cancer 3 to 12 months prior. They need to be treated with curative intent, so they need to be stages 1 to 3. And they need to be able to complete surveys in the English language, as we didn't have the funds to translate the questionnaires into other languages. Patients are excluded if they have muscular or neurological disorders that could limit them from exercising, and the patient's treating clinician always assesses the patients to be eligible for the study. Now, the intervention involves clinicians, and they can be urologists, radiation oncologists or urology nurses, referring their patients to the 12-week program using a specific referral slip. Now, we know that clinicians are viewed as the most credible source of information by patients, and so we've developed this referral slip. It's something like a prescription pad slip, so that when the patient's referred to the program, we're trying to formalise and standardise the referral. So the clinician fills out the patient's name, the date of the referral, goes through this information with the patient, and then signs off on it. So as I mentioned, the participants undertake a 12-week program. It involves 2 supervised exercise sessions per week at a gym at a local YMCA, and 1 individual home-based exercise session per week. And as I said, that's targeted and individualised for the participant. The sessions are supervised by an exercise physiologist. So the gym work involves a combination of cardiovascular exercise for 30 minutes and strength training, balance and flexible exercises. And at home, the participant follows an exercise program that includes balance, the use of TheraBands and flexible exercises. For the control group, this involves participants who receive usual care in terms of any recommendations by their clinician in terms of any exercise program or physical activity recommendations or discussion, which is provided during the consultation. So our primary outcome measures are to look at how much participation in physical activity or in exercise, and we're using a standardised, using a standardised leisure score index, which is a well-validated tool amongst cancer patients. It assesses the average frequency or duration of mild, moderate and strenuous activity during the leisure period in a typical week. So examples of mild exercise is easy walking, moderate is brisk walking, and strenuous would be running, swimming, so that type of aerobic exercise. We're also keen to determine what impact the exercise program has on participants' quality of life and their anxiety and depression, and any changes in their symptom management. So the main study commenced in October 2011. We're recruiting patients through Peter Mac, Austin Health, Epworth Healthcare, Ringwood Private, Northeastern Urology and Eastern Health. We have 124 patients who have been recruited at present, 51 in the intervention and 73 in the control group. This gives you a visual of the recruitment. So we've got 6 clinicians in the control condition, 8 in the intervention. We've screened around 400 patients, and around 100 of them weren't eligible to be involved in the study. But of those who were eligible at the initial point of contact, 76 were interested in having the information and being followed up for the control condition, and 68% were interested in being followed up for those in the intervention condition. When we followed them up 2 days later, after we initially spoke to them at the outpatient clinic, 47% consented to being involved in the project in the control condition, and 39% in the intervention condition. So we're looking at around 45%, 44% overall participation, which is very good for this type of trial. So if we have a quick look at preliminary analyses for 104 participants, of which 41 are in the intervention and 63 in the control arm. The age range is from 39 to 84 years, and the average age is 65. Self-report treatment status, 67% or 2/3 indicated that they'd had surgery, 48% reported that they'd had radiotherapy, and 20% were on ADT. The cancer stage, 90 participants or 86% reported that they had localised disease, 10% had locally advanced disease. Nearly 3/4 of the sample were married, and 2/3 reported that they participated in light intensity exercise during the previous week. Half participated in moderate intensity exercise, and 15% reported that they exercised at a strenuous level. And there can be a combination of those three aspects. Of concern to us was the 9% or nearly 10% of participants who didn't participate in any exercise whatsoever. We asked participants what impact the clinician's recommendation had on their decision to be involved in the program. So we asked them what influence the clinician's recommendation and referral influenced their decision. Nearly 2/3 indicated that it influenced them either quite a bit or very much, and 13% reported that they weren't sure if it had an impact or not. In terms of program satisfaction, 3/4 of the sample reported that they would recommend an exercise program to other prostate cancer survivors. Over 90% reported that participating in the program was extremely or quite useful in increasing their exercise capacity and their exercise generally, and 88% reported that the program was extremely or quite beneficial for them undertaking exercise. We asked participants about the duration of the exercise program. 50% or half reported that it was too short, and half reported it was about right. The exercise trainer was reported to be extremely supportive in 87% of cases. So that's the exercise physiologist who supervises the 12-week training program. We were interested in knowing what intentions participants had in terms of either continuing with an exercise program at a gym. So we did ask them their intention to join a gym in the next month. 44% reported that they would be, and nearly 20% indicated that they were already a member. So what's the significance of this study? We wanted to look at the complex needs of prostate cancer survivors and improve their health outcomes in the short and long term. We want to involve clinicians in the delivery of the information to prostate cancer survivors about the benefits of exercise. We want to improve the knowledge and understanding about exercise among survivors, and this will have the potential to reduce clinical demands and costs of care into the future. Thank you.
Thanks very much, Trish. We've got one over here. Yes? Hang on, I'll just get to you with the microphone, that way we can all hear.
How much did their fitness improve?
How much did their fitness improve? Good question.
The study's not finished yet. We're still recruiting participants. So we've had a look at preliminary analyses, and there is a significant difference between those in the intervention and those in the control groups, where there's around a 2.5 hour difference between those in the intervention group who've undertaken more exercise in a given week compared to those in the control arm.
Great.
But that's very preliminary, and we haven't finished recruitment, so we're yet to see the outcomes of that.
Cool. And over here?
My question relates to, with the exercise, was diet also a consideration during the 12-week period?
No, we purely looked at exercise and improving exercise levels over that 12-week period. But it's a very good point that we need to include diet. And we are looking at developing up a program that looks at diet as well as exercise into the future.
Hi, this probably follows on from the gentleman's question before. I appreciate your current study focuses on prostate cancer survivors, but I'm just curious to know what the factors or what the known factors are for prevention of disease in relation to specifically exercise or diet.
That's a big question.
It's great. I'm back on the mic so we can all...
Oh, sorry.
Right.
There's a whole host of literature out there about prevention and the benefits of exercise. We know that there's, for those people with prostate cancer who undertake exercise, there's at least a 15% decrease in depression, and that's a conservative percentage. And that's following on from systematic reviews where they've undertaken, or they've looked at a range of studies for depression and anxiety, and you'd have... yes. So there's systematic reviews that undertake those sorts of reviews of studies to garner that sort of information. But I'd need to get that to you.
We've got another one over here, so I'm going to go the long way. Hey, just while I'm walking, of the 44% who said they had already gym memberships, do you know how many actually used them? No, I'm serious, but do we know that?
No, we don't.
Thank you. I think you mentioned earlier that of the participants, about 75% have a partner.
Yes, that's right. Yes.
Have you measured at all the extent to which partners have influenced participation and compliance and so on, or engagement at all?
Yes, we have found that participation is a little influenced by partners, and either encouraging or not encouraging them to be involved. And I guess it's a matter of not knowing about the exercise program and its benefit, because once we've found that once participants are in the exercise program, we've got an 85% compliance or adherence rate. So, and the feedback that we've been receiving from the participants has been extraordinary. Many have said that they wish, more men with prostate cancer could be involved in a 12-week program, which would then be extended. Our first participant actually set up a gym in his own home after the program because he loved the benefits and saw the benefits after only 12 weeks. So we've had a fantastic response from the participants. But it's a good point to engage the partners as well as the men themselves in explaining the details of the program.
Thanks. That's a really nice thought, actually. We've got time for one or two more if they're here. One over there. Yep. Oh. So I'm demonstrating exercise.
Well done. I demonstrate somebody who doesn't have it. I work in aged care, and quite a lot of our gentlemen have prostate cancer. Very little exercise programs are encouraged in aged care, even though they tell us they do them, but they don't. There's not enough funding. My question to you is, can we not encourage our government to fund better programs further on in our aged care? You say that the age group cuts off at about 84. In aged care, they're a lot older, and quite a lot are coming in younger now. And we need to encourage, I know the younger ones, we've got, some of them are in their 60s with early dementia, but they've also got prostate cancer that need treatment and need encouragement and don't get it.
Look, that's so important, and what we've been able to demonstrate is that you can undertake home-based exercise programs quite effectively, as we've got one session of that 12-week program involved a home-based session. So you could roll that out to any residential establishment and set up a home, like an individually targeted program for the individuals in aged care. I mean, that's manageable, and you're right, it needs to be funded, and the exercise physiologists are well placed to undertake that type of assessment and design and implementation of that sort of home-based or residential-based program. And I think it's a very valid point that is worth pursuing.